So for those who don't know what Elekta is, it's an oncology company. Elekta builds radiation therapy devices, one of two companies in the world that does this. The company I just sold about 4 months ago does safety software for radiotherapy devices, so that's what it is. So what I'm going to talk about here is the Canadian healthcare system. So this is the, I guess, consumers of what we built here. There's a good innovation society and ecosystem in Canada, which I believe in. And at Acumen, it's the company before we sold it, that's what it was called. We used and benefited from the Canadian system and support system quite a bit. So I would say without the business and entrepreneurship programs that exist today, we wouldn't have been successful. What really bothers me is the healthcare system that should be using those innovations that our Canadian taxpayers are paying to build are not really absorbing and adopting what we built here. So I'm going to talk about the experience we went through and what I've also seen from my fellow entrepreneurs as we went through this path. So I'll start with this. I think everybody has seen Jeffrey Moore's adoption curve, so it's a familiar thing. I think when I look at the Canadian and Ontario entrepreneurship programs, we have a really good push to move companies from the very far left towards further. The problem is the Ontario and Canadian healthcare systems sit somewhere in that hump where the green and blue sections intersect. So they literally, the way I look at it is, we're pushing our entrepreneurial systems forward to develop something new and interesting and different, and we're giving all the support to them, and the Canadian healthcare system is stepping backwards from taking it away. And that was our experience. So what happens? Like in my mind, building a business is a few very simple steps. I like simple things. I hate complexity. So even when I was working on my rocket science job, building rover missions to Mars, you gotta simplify things. When I build my business, there are 3 or 4 major steps that I take. The first one is design your business. What is it that you're gonna do? For whom? What kind of market? Who are you gonna sell to? Everybody knows of the business model canvas. Start with this. If you're familiar with the entrepreneurial field, there are lots of good incubation systems in North America, and especially Canada and Ontario. Very good support from business leaders, mentors, executive in residences, seed money, peer groups like this, which really enables idea owners to put a business plan together. There's good market research being made available to organizations. So when I was building Acumen, I spent around 8 months building our business plan. And the plan is not a piece of paper it's written on. It's where you do your negotiations for agreements, where there are key agreements that needs to be in place. Figure out what your business model is, how are you gonna make money, who are you gonna sell to, what your customers care about, what are the critical features that you need. We got good support. We were part of the ecosystems in University of Toronto and Mars environment. We benefited from this. So thanks to tax monies, including mine, I think we got quite a bit of support. Next thing, once you figure out what your business looks like or should look like, is you go build your minimum viable product. This is really R&D. You understood what your market needs, what kind of features will make the customers excited about your product. Now you go back and build it. Again, there are very good support systems out there, as I said, in that adoption curve, pushing you forward. Hiring people, support grants. We got maybe 1/3 of our full funding from government grants. We hired maybe, 80% of our staff through some sort of support from the government. We did really well. And then came that validating MVPs. We have a product, we took it out, and this is where the health system failed us. This is where we went out, and I offered our product free of charge to Canadian health system. Here, we built it with Canadian support, take it and use it. After months and months of meetings, I had nothing. In the meantime, of course, that wasn't my only path. I went to US, within a week, I sold one. And US bought it, Canadians wouldn't take it for free. As a business owner, where do you focus your attention? Where your money comes from. So my attention, of course, and it was US and somewhere else. So we validated our MVP in the US, in the Netherlands, in the UK, in Australia, and not in Canada. Then comes scaling up. This is where we got gobbled up. This is where Elekta came in and said, we like your product, we like what you're doing. At that time, we had about, I'm not going to give the exact number, but dozens of customers in the world. The countries I talked about, including Brazil, France, like we kept adding customers, paying customers to our roster. We had 2 Canadian hospitals. Both of them got it free of charge. One of them was the company, organization that we spun out of. To me, this was pathetic. Now we're part of Elekta, a big global company, Canadian healthcare is buying from us because it's proven somewhere else. I hate my tax money to go somewhere else before it comes back to benefit Canada. So apart from my day job, actually I'm looking for your help. I want to go back and fix this because I hate inefficiencies, I hate wasting our tax money. I'm looking for your input because I think the commercialization will only work when it's continuous and smooth and effective. Please share your experiences with me. I want to gather enough evidence to go back and form a little group of people to go back to the government levels and try to fix this. So that's my mission. Thank you.
Are there any questions?
Do you have any ideas for solutions?
Yes. So I think that the real broken part is for people who didn't hear the question, if I have any ideas for solutions. It's a procurement system. If you go to hospitals, their procurement system is not clear. The responsible, accountable decision maker is not clear. It actually doesn't exist. It's big committees of people. I had meetings with Canadian hospitals where the head of the department says, this is exactly what I need, and you're giving it to me for free, so I'll take it. 6 months later, I still couldn't give it to them. And I don't know where it got stuck, but we got into this, I guess, years of procurement and we got chewed away. I think that's where the real problem is right now.
Did you try selling it in the Canadian market? I'm wondering if maybe part of the problem is with free, people just don't trust it.
Well, of course I tried selling it. Of course, that was my first approach. And typically when I say free, it's use it for a period of time for free. If you don't like it, throw it away. You're under no obligation. So to give you more specifics, to Canadian hospitals, I offer 2 years free of charge, full support, full upgrade. And if you don't like it after 2 years, if our value proposition is not right, don't use it. With US, I gave them anywhere between 3 months to 6 months. So it was never free, but it was to prove the value proposition.
Any last questions?
My question is, since there is a new government in Ontario, so do you think it's going to get quite a change? They talk a lot about the privatization, like innovation in healthcare, and they're in low position.
I don't think so. I think the focus is still on the innovation side, which I think is okay. The ecosystems around, I think the understanding is we push lots of startups and create this pipeline and we help them through. I think that part is working fine. It's the receiving end where the problem is. I don't think that's recognized. I don't think the new government comes in with a understanding or mandate to fix the receiving end. So I don't expect anything either.
Perfect. Thank you so much.